Environment Secretary is with us, Mr Eustice. Good morning. It's
morning.
Lovely to see you. Freedom Day may be pushed back at least a fortnight, is what we're hearing in the papers this morning. What credence are we giving to that?
Well, look, the Prime Minister's always said he's going to take this a step at a time, and that with each set of relaxations, they're going to basically assess the data when we get there. So we can't make the final assessment until the 14th of June. That's what he said all along. And we obviously don't rule anything out. The critical test, really, is are those people with the new variant, are people who've had the vaccine getting infected. There have been a couple of cases, I think, not many. It's encouraging, and we're obviously making good progress on the vaccination. But it's too early to say yet. What we'll do, we'll be announcing that next Monday.
OK. Apparently there was a briefing yesterday to the Prime Minister and others from Valence and Whitty suggesting the figures are, at this stage, grim. Which side are you on moving it back or not, as we speak today? Well,
I'm not sure I would say it's grim, in that we've seen an increase.
Those were their words.
Yes, well, we've seen an increase, obviously, in the infection rate. So that's gone up, ticked up. If you look at the graph that we're all seeing now on the news every evening, it's gone up, that's for sure. But what we're not seeing at the moment is that growth in hospitalisations associated with it. And that's because we know that if people have the vaccine, particularly once they've had the second jab of the vaccine, it actually does give them immunity to this new strain that's around. But there have been a few cases of people who've had the double jab who've then gone on still to get that to get infected again, and that's why we need to look very closely at this.
Watch the news in the morning as well as the evening.
Yes, of course.
One of the biggest factors, of course, is the India variant. If only we closed our border a little bit earlier, when we did with Pakistan and Bangladesh, that might have made all the difference.
Well, this has been a dynamic situation all along, things moving very quickly. We closed the border to Bangladesh because we were seeing, if people arriving from there, a higher incidence of the coronavirus. And, although, we also know that India was testing much more. So the numbers that they were picking up, you'd expect them to pick up more because they were doing more testing. As soon as we saw that surge in India as well, we obviously closed the border. So we review this all of the time, the travel bans. Every few weeks, we're reviewing who's in those lists. And India was added as soon as the data supported that.
Well, I'm just looking at the figures. I mean, Ed Conway, our economics editor, was looking at the figures on our behalf quite recently. 25th of March to the 7th of April, and these are NHS test and trace figures. Bangladesh was at 3.7%. They were put on the red list. India was at 5.1% of people arriving had tested positive, and yet they weren't put on the red list. Why do you think that was?
Well, look, this was obviously a few weeks ago. My understanding is that India had a higher incidence rate that it was reporting, but that's because it was doing more testing.
The test and trace figures here, not what happened in India, but when people were arriving in this country, of those arriving, according to the NHS test and trace, there were a bigger percentage of people from India who were positive than Bangladesh, and yet we put Bangladesh on the red list.
Well, I'm not sure. I mean, the data, that, as I understand, yes. Well, as I understand it, and Matt Hancock made this clear at the time, initially the incidence of the virus in people arriving from India was lower, and overall, while they were reporting high numbers of cases, that's because they were doing more testing. Now, I don't know the date of that particular. It may be that was just
25th of March to the 7th of April.
Right. Well, I haven't seen that particular data, I have to be honest. Okay. But my understanding is that the reason we put Bangladesh on the list earlier is that they were seeing higher instances. I
mean, their figures were lower. Look, they're the ones at the top bar.
Yes.
The figures were lower.
Well, I know that they were testing less and so reporting fewer cases.
No, I'm talking about NHS test and trace once people came into the UK.
Well, we were also looking at factors such as their ability to do genome sequencing, and, we're looking at all of this when we assess other countries, their ability to be able to pick up new variants of concern, for instance. And India does have better testing in place than other countries like Bangladesh.
I'm talking about the figures in the UK, not about what happened in India or indeed the other two countries that we talked about. Was it a political decision?
No, it's not. So they regularly review this based on recommendations that come from SAGE and the Joint Biosecurity Committee. They look at that data and they make those assessments at the time.
But we were very keen for the Prime Minister to go to India at that time, around that period, weren't we? Because we wanted to do a trade deal with India. So it was in the interests of the British government to keep the border open with India.
Well, look,
I mean, it's fair to say that.
Well, I don't. That's not the reason. So the Prime Minister was, yes, due to travel to India, but we then put India on the red list, and that obviously was cancelled a couple of weeks before he was due to go.
But that was a couple of weeks after you did it with Pakistan and Bangladesh.
Yes, but I mean, as I said, my understanding is, and this was covered at great length at the time, that we had fewer concerns about India at the time because they were testing more, and also because on arrivals, my understanding is that they were showing a lower incidence rate.
Certainly lower than Pakistan, but not lower than Bangladesh by any margin. Bangladesh was at 3.7%. India was at 5.1% when they were arriving here in the United Kingdom. I was reading a report from, he is Associate Professor in Cellular Microbiology, Dr. Simon Clark, and he was saying that he felt that there was probably a political element because the UK wanted a trade deal with India and the Prime Minister wanted to go. That's nonsense.
Yes, that's been dealt with at the time. Matt Hancock's been asked. I think he's explained at great length that the criteria that we've been applying when assessing who should be on the red list are what the incidence rate is that's reported, but also their capacity to do testing, their capacity to pick up variants of concern, the incidence of those that are arriving. So there's a range of factors that are looked at. It's not just one single measure.
Yeah,
and India was added as soon as we saw a spike in rates and as soon as we thought there was a reason for doing so.
And as the rest, as they say, is history. On reflection, do you think it's appropriate that the British government apologise for not closing the border sooner?
Well, look, we're going to have a review into the whole pandemic and how it was conducted. There's going to be an inquiry that starts next year. That's going to look at great depth at everything, right from the beginning of this pandemic, right the way through, how people reacted. If there were lessons to be learned, then we should wait for that inquiry to do its work and then we'll learn any lessons.
We've certainly closed the border very quickly with Portugal, haven't we? People had to get in by 4 o'clock this morning or thereabouts. Swiftly moved from the green list to the amber list. Do you think probably on balance it's better that people holiday at home this year?
Well, look, basically now there are very few countries on that green list. Our advice all along has been don't travel unless it's absolutely necessary. Obviously, we had hoped with these 3 categories that we had, we'd hoped that the situation would be improving in other parts of the world, that we'd be able to progressively add other countries to the green list. Sadly, that's not the situation. We do have this new variant of concern, first identified in India, that is now cropping up in other countries. And we've just got to take a very cautious approach. The most important thing is that we can continue to open up our own economy, get back to life as normal here. The biggest threat to that is that we would have a variant come from another country that would find a way of getting around the vaccine. That's the biggest threat to us at the moment. That's why we should be really cautious. Yeah.
So do you think people, I don't know, would you rather holiday in Iceland or would you go down to your home county of Cornwall?
I shall be
You'll be in
spending
Cornwall, I'm sure.
Cornwall
But what should people do? Should they risk a green list given that people have had to scurry back very quickly?
Well, look, people will make their own individual judgments on this.
What do you think? I mean, it's a very dynamic situation at the moment.
It is. I will be staying at home. I've no intention of travelling or going on a holiday abroad this summer. Some people may, but they have to understand that there are obviously risks in doing so because it is a dynamic situation. But I think most people will probably decide this year to stay at home, holiday at home. We've got some fabulous places to visit in this part of the country, not least, of course, Cornwall, although it'll be a very, very busy summer, I'm sure, Dan.
And that's the right thing to do?
I think my advice to people would be a holiday at home. We've got some great places here. There aren't many countries that are on that red list. But obviously, you know, some people will want to travel abroad. There are still a small number of countries on that green list. If they wanted to do that, they can. But obviously, they'll have to understand that there are risks in doing so as well.
And with some of them, get the map out as well. I didn't know where some of those places were. A lot of G7 leaders, of course, coming to your home county. Do we have a special relationship with the US?
I think we always have had a special relationship with the United States. We're important allies, have been now ever since the Second World War. We've been through a lot together as countries. So, yes, we are important allies, always have been, regardless of who's in the White House.
I read the Prime Minister said today that it makes us sound needy and weak to say we have a special relationship.
Well, it depends how you see it. If you see the special relationship as meaning that we always have to go to the United States to work with them on things, people may see it that way. But actually, a special relationship could also be a special bond of trust where you work together on things, and that's what our relationship is.
I mean, we do need a trade deal with them, and we would be weak without it.
We wouldn't be weak without a trade deal with the United States, no. But obviously, we would like to do a trade deal with the United States.
We'd be weaker without one, wouldn't we?
Well, we've got trade deals with other countries around the world. We do a lot of trade with the United States. We have a trade surplus with them. They are an important trading partner. Of course, it would be good to get a trade deal with the United States if we could get one on the right terms.
Brussels are very cross with us at the moment as far as trade deals are concerned there. They're threatening a trade war if the UK overrides the Brexit treaty. I had a government minister sitting where you are yesterday, and she said that the deal with the Northern Ireland border, or the Irish Sea border, is harder than anticipated. Do you agree?
Well, I think what you have to bear in mind is that the protocol always envisaged that both parties would show best endeavours to make the Northern Ireland Protocol work, and that included recognising that Northern Ireland was an integral part of the UK and that you should support the free flow of goods to Northern Ireland. And what we really need the EU to do is to respect that part of the protocol and put in place sensible measures to remove things like the nonsensical ban on selling sausages or chicken nuggets to Northern Ireland, not just requiring paperwork, but actually having an outright ban on some of those goods. That clearly doesn't make sense. It had always been envisaged that there'd be a joint committee process and specialised committees that would look at some of these technical matters to iron out the creases. And we just need the European Union now to engage in that process. And talks, I think, are starting this week.
Indeed so. Lord Frost very much engaged. But do you acknowledge that it is harder than anticipated, this deal, even though you were told at the time by former prime ministers, leader of the CBI, people like that, that it would be a very difficult process?
Well, what I would say is we'd obviously hope that the European Union would engage more fully in the joint committee process and in those specialised committees to identify solutions to some of the issues, such as a ban on the sale of sausages in Northern Ireland, which doesn't make any sense. Other issues as well, such as if you're delivering goods and you're a supermarket and you're going direct to store in Northern Ireland, there's no risk of those goods ending up in the Irish Republic or in the European Union, in the single market. So that could be recognised and special measures could be put in place. So there are solutions that are there, using digital technologies to make this work. We're committed to making it work, but we just need the European Union to engage in that process to iron out those issues.
Sausage and chicken McNugget wars, that sounds enticing. Let's see where that takes us over the next few months. I wanted to ask you about a report from Jeremy Hunt. He used to be the Foreign Secretary, was before that the Health Secretary, as you know, a colleague of yours. He's now chairman of the Health and Social Care Select Committee. He says NHS staff are suffering from burnout and they are not being supported the way that they need to be by the government. What would you say in response?
Well, look, we had a manifesto commitment to recruit more nurses, an extra 50,000. We've already recruited 12,000 nurses. You know, we are expanding funding for the NHS. We are recruiting more staff. Yes, of course, they've had a difficult year. If you're dealing with a pandemic, as they've had to, it's been a very difficult time. They've done extraordinarily well. We are doing all we can to support them. But the critical
thing... Not enough, though, is it? That's what he's saying.
Well, I'm not sure what more we can do. They've worked very hard.
I'm guessing they'd say.
Well, there's been a pay rise and there's a review looking at that issue again. But we're also recruiting more staff. And if the issue is that they feel under pressure, and that's entirely understandable, having been through this pandemic, one of the things that we're doing is recruiting more staff, and we've already recruited an extra 12,000 nurses. Just before I let you go, animal protection. What's the plan? Animal protection?
Yeah. I know that's why you were here to talk.
Oh, no, oceans. Today is World Oceans Day, and we are announcing today that we're going to accept the recommendations of a review, that we will put in place highly protected marine areas. This is where you would prevent any activity there, whether it's extraction, such as fishing or aggregates, or indeed even wind farms, in order to enable these areas to fully recover. And there are a lot of benefits for the environment in doing that, so we're going to pilot some of those sites. OK,
World Ocean Day. How are you going to celebrate it?
Well, I shall be doing...
It's very close to our heart here at Sky. We love the oceans. As you know, we have massive campaigns to do our bit.
We do, and I think the public are very concerned about plastics in our oceans. Sure. And very concerned about some of those threats to marine life and indeed overfishing. And it's one of the big issues, actually, that'll be on G7.
Indeed. You're going down there this week?
I should be going down on Wednesday night. It's happening just across St Ives Bay. My constituency's at the other side of that. And I've got a number of events that I'll be attending.
Fantastic. It's good to talk to you. Thank you so much for taking the time to join us this morning.